Oh, snaps!
The world is finally waking up to the crap that's baked into and sprayed on kibble dog food. No longer can commercial pet food manufacturers fool us with pretty pictures and false promises. This is the raw dog food truth. The view and opinions expressed on this podcast are not intended to replace medical advice. Before starting any raw diet, do research, ask lots of questions, and consult your vet.
Well, hello, raw feeders. I'm DeDe Murcer-Moffett, CEO of a Raw Dog Food and Company, where your pet's health is our business, and we're friends. Like my friend, Dr. Judy Jasek. Well, she didn't let friends feed kibble. She didn't even sell kibble, which is, Dr. Jasek, this is a telltale sign. Are you a holistic vet or not? And when customers come to me and they say, well, my vet, is pretty holistic. And I say, well, do they sell prescription diets? Yes. I'm like, well, that's not holistic. Right? What do you think about that?
No, I think holistic is all or nothing. It's not like, a lot of vets call themselves holistic because they're mostly conventional, but they do some holistic stuff. Like maybe they've learned how to do acupuncture. They've learned how to do chiropractic, but they will still fall back because they don't know anything about nutrition. So what do? Well, they'll just, rely on the prescription diet recommendations because that's easy, because that's standard of care, right? So they're going to do the things that they aren't going to get in trouble for. Like if they start learning something new to feed raw or they want to introduce raw to their clients. Well, there's a lot of pushback in the veterinary profession. So they pick and choose, acupuncture is pretty well accepted, chiropractic, pretty well accepted, raw feeding, not so well accepted in the conventional veterinary world. So they don't want to do the hard stuff. They don't want to do the controversial stuff. So they pick and choose. And I heard an example, a veterinarian I know in Colorado, classical homeopath. So this is like her specialty was homeopathy. So I would have thought she'd be very holistic. Well, one of my clients I'm consulting with out here went in to see her, and this dog has just had chronic skin stuff. We just have had a heck of a time trying to get this dog straightened out. So she went in to see if homeopathy would help. Well, they tried a couple remedies that didn't work. This veterinarian said, why don't you just try Cytopoint? And she said, the vet kept contacting her and say, why don't you just do Cytopoint? Like a couple of tries didn't work. And so again, we'll just go back to the conventional way of doing things. And thankfully this client is very holistic and didn't go down that road. She contacted me first, but that's their chicken. I think they're chicken to go, they'll go a little outside the box, but not too far outside the box. And for me, it's all or nothing. You either approach your patient from, the perspective that you're supporting the whole body and you're supporting the healing ability of the body, you're healing the terrain, or you give symptomatic treatments. I don't know how you go back and forth and have a foot in both worlds, but that's really what's going on out there. And people have to be really, really careful because I think people get misled. They go to a vet that calls themselves holistic and then they recommend a prescription diet. Well, this must be holistic because my holistic vet recommended it. But it's really up to the pet parents to scrutinize these veterinarians on behalf of their pet.
It's different in the medical world. And I would tell you, we've been dealing with some cancer in our family. And when you look at people who have to eat a soft diet, maybe it's through a feeding tube or something like that, what you're going to see are products that cancer hospitals use that are full of chemicals and additives, such as like a Kate Farms or an Insure or a Boost or any of these kind of products, right? And when you look at like Kate Farms, okay, they have a great story behind them and why they started. But I think once you get into that mass production, right, things change. And asking the folks that want to file this on your medical insurance, we had found a product that is called Real Foods. Okay, Real Foods, zucchini, turkey, squash, whatever. It's real food that you can use. And I said, why would you have to go through trying to get a food approved that doesn't have chemicals versus one that does? And she looked at me and she said, money.
Mhm.
Money. It is money. The food that has real food, okay, in it is way more expensive than your chemically laden, mass produced food. And people will ask me, how much is a raw diet versus the stuff I can buy at Sam's in these great big bags? And I say, well, we're not comparing apples to apples. If you want to compare a steak to a steak, that's one thing. But you're comparing cakes, cookies, and chemicals to a steak.
Right.
So
You're comparing a steak to a box of Fruit Loops or something.
Right. And it is amazing to me that is lost on many pet parents.
I know.
It's just lost on them. We do this one thing, anthropomorphism, right? Is that what it's called?
Anthropomorphism.
There it is.
Basically, we push our stuff on our pets.
Right. Now, but it's not that way in the foods. So they know, okay, I shouldn't eat processed food. It's not great for my body. As a matter of fact, I was thinking about this, Dr. Jasek. I wonder what we as human beings would look like, our hair, our skin, our eyes, everything, if we never ever put processed food in our body. Because you and I know there is a major difference in the way that pets look, cats and dogs, when they don't eat processed food.
Mm-hmm. Absolutely.
So it would be very interesting. Do the people that never put processed foods in their body look younger and healthier than those that do? I would say yes, but I'd love to line them up.
I'd say so. I hope I look better than my
you at 100. You don't
food
look a day over 60. I'm just telling you right now.
Thanks.
No, you look great. You look great. And I know you and Chris eat really, really clean.
Oh, yeah, absolutely. But, well, I think people see the increase because I hear this all the time from our clients too. They're feeding kibble. We go over all the reasons why they shouldn't feed kibble. And they're like, okay, they're all ready to go. And they're like, this stuff's expensive. Like, well, what's your pet's health worth? And if you compare the increase, I think people see the increase. Like kibble, I got no idea how much kibble costs because I wouldn't touch the stuff. I wouldn't even touch the bag at the store to see how much it costs. That's how much the stuff repulses me.
Right.
But I know it's a big jump, right? But what's your pet's health worth? I mean, yeah, it's more expensive, but what about treating cancer, autoimmune disease, chronic itchy skin? How many trips to the vet is it going to save you? Because your dog not only is healthier, but I think they're more resilient if they do get into things. Dogs are scavengers. They eat stuff all the time. Rex, he's constantly eating stuff. I don't have any problem. He didn't even throw up anymore. He used to be like, once a week or so, he'd erp up something in the middle of the night. He didn't do that anymore. Because his gut's strong and it's resilient and he can go out and eat all this stuff. His favorite thing now is the hay from the chicken run because I put hay in the winter because there's not grass growing. So keeps him dry and stuff. So when that gets dirty, I throw it outside the run and he just lays in there and munches like poops out hay, but it doesn't seem to bother him. Like, you gotta pick your battles on the homestead. Like you can't keep him from eating all that stuff, but it's not hurting him. I mean, his gut can just handle it. So you're not getting these, I guess my point is you're not going to get these diarrheas or these chronic issues that that show up in the pets when they're eating a diet that's keeping their body healthy. So what's that worth to you? I mean, to me, I don't understand. I don't figure out how much money I spend to feed my dog because I'm going to feed him how I feed him. And I mean, I guess if I just ran out of money, I'd figure something else out, but I got the money. So I'm going to compromise. Like I don't sit like, oh, how much does it cost me to feed my dog? We don't do that with ourselves either, because we believe in eating well. I'm sure our grocery bill would shock people because we buy such high quality food, but it's a priority. So I think people need to realize how, when I tell people it's the most important thing, if you do nothing else, do the diet piece. Don't spend money on 50 supplements, do the diet thing. Because I think people like to, well, what if I feed kibble and then just add in all these supplements? Well, it's a lot less healthy and you're spending money on the supplements. So it's just really hard to get people to see. I see people talk to people all the time that we talk to them and they get it, they seem to get it. And then you talk to them a couple of months later, wow, that was pretty expensive. So we're just feeding a little kibble now, just here and there. Or they switch one dog, but they can't, switch all their pets. And I mean, I don't know. I get it that it's expensive, but what's your pet's health worth? If you can't afford to feed multiple dogs a diet like this, then not saying people should give up their pets, but think about if you're going to get another dog, what do you want to feed them? And take that into account. But all we can do is give the information out and
right. Another thing that people get confused about, they think I need to keep my new puppy that I just got from a breeder on the kibble that the breeder was feeding because somehow the breeder knows what's best for the dog. Unless they are, what do we call them? Natural rearing,
yeah.
breeders, right? They're all going to be feeding kibble, almost every one of them. And I'm sorry, but I don't think there's any reason to start a puppy out on kibble. That is like saying my newborn just popped out and we're going to just start giving him Pop-Tarts because, that's what the nursery was giving him or some sort of silliness like that. This is not the way that they are meant to eat. Not at 8 weeks, not at 12 weeks, not at 6 weeks.
Any age. And I think the earlier you get them transitioned, the better, because they haven't been eating kibble too terribly long and they've been nursing, kind of up to that point. So their gut isn't completely ruined by the kibble at that point. So I think most of the time puppies can do a really good, I just say just cold turkey puppies and, get them just get them right on raw. And breeders, they feed some of the worst diets out there because they usually have multiple dogs and it's like Victor or some Sportsman Choice or something, cheap kibble. They're not even, because they're buying it in bulk. There's some of these companies, I think they can buy a little more in bulk and it's cheap. They don't feed good kibble because they have multiple dogs and they, I guess, aren't making enough money selling puppies to feed their dogs, which, it's another thing that gets me, like you're making money, you're using these dogs to make you money and you can't even feed them a decent diet. Like that's just terrible.
It is terrible. And I'm going to tell you another thing that's terrible. You sent me this information on Librella. Dr. Andy and I had talked about that many, many months ago as well. And it is still a major issue right now. I think more is even coming out on this, Dr. Jasek. Librella is for osteo arthritis, or is that mainly what the vets are prescribing this drug for, and why is it so dangerous? Let's talk about that.
Yep. So it's for arthritis pain. Librela, and there's a companion product for cats, which I can't think, Silencia or something like that. So same kind of base thing that they make one for dogs and one for cats. And I think the reason this took hold in that article I sent you, you know, they're not talking about what it's doing for the pets. They're talking about how much money they made because it just took off like wildfire. Well, it could be a win-win if this were a safe product or people like they're just take their dog in once a month for this injection. They don't have to worry about giving, medications for pain or anything like that if the dog really needed it. Of course, I don't tend to advocate for things that you can't take back out of the body that are in there for a month. But, from a convenience standpoint, people liked it. The vets, of course, love it because they got clients coming in once a month for this injection that I'm sure wasn't cheap. So you can see why it took hold in the world of conventional veterinary medicine. And the clients I heard back from that started using it before I knew how bad it was, said it really did help. It helped in dogs and cats. And I had actually one of my employees, she had a kitty that was just acting sick. It's an older kitty, but we're like, just couldn't figure it out. And the cat was really starting to fail, like really declining. And like she was doing blood work. And like, I can't figure this out. And then all of a sudden it came out that she was getting the cat version of this drug. And I didn't know much about it at that point. I said, we need to stop that. And now the cat's fine. The cat completely rebounded. But I've seen more, pets going into kidney failure, elevated kidney values, so kidney compromise, even some lymphoma diagnoses. Now, this I heard mainly from my clients that like were giving their dog Librela and their dog got sick and they'd go out like on Facebook and stuff. And there was more people talking about how their dog was fine. And then they started this Librela and they started getting sick. Now, of course, nobody's going to do that side-by-side study, right? Because that would be the pharmaceutical company would have to pay for that. And they're not going to pay for a study that says don't use our product. But what was really disturbing about that article is they're like, all this evidence is out there now, and they're still just saying, oh no, it's safe, it's fine. And it was like something like it was like one of the most effective releases or something like that. But just because it made so much money, not because it helped the pets, it's because it's like one of the biggest money makers in like veterinary pharmaceuticals.
Yeah, they call it the best launch in animal healthcare ever, touting double-digit sales growths for the third quarter of 2024, reinforcing Librela's billion-dollar trajectory. Now, here's the thing. The FDA did step in and say, hey, something's happening here, is, sending out a warning. And Zoetis just basically downplayed it and kept going forward. So the question is, how much power does the FDA really have over a big conglomerate like a Zoetis?
Right. And Zoetis, if for people don't know, is like a branch of Pfizer. So we're talking big bucks. And they probably paid them off. They probably just have, there's these big corporations just give, kickbacks to the FDA official that is, investigating the case. They either give kickbacks or threaten them to, let's just make this go away. They'll make their $1 billion or whatever their target is, and then they might do something different, but they want to meet their financial goals first.
So we are sending out a warning, backing up, this worrisome drug. We're saying, don't do it. Don't do it. And even if this is a really tough one, Dr. Jasek, because I see this in the they go both ways, these the veterinary clinics. So they will just ride along this giving out the Librela, even though they are very aware that it is causing massive problems, right? On the other side, they will tell people to not feed raw foods to their dogs because their dog might get bird flu. And
Right.
and then they start telling them cook their food, and I got a note from a customer who said my vet sent me this information, and I said, well, where's the scientific evidence, right? We're talking about two cats, right? Or a few cats. And we don't even know that had died, right? And they're trying to link that to the bird flu, that these cats were actually drinking some type of milk. And then, oh, just somehow they had the bird flu. The problem is that they don't actually have any scientific evidence that points to the bird flu. And then if you go through Christine Massey's information, all of her FOIA requests, right, that ask over and over again, send me the scientific evidence of this virus, that virus, HPV, monkeypox, rabies, this and that. They can't provide it. But you can just push a narrative out there, like cardiomyopathy, the dilated cardiomyopathy that was total bogus, that, Lisa Freeman from Tufts University was paid to kind of, change all of the information, which is why they're being sued. Hill's Pet Food is being sued. Won't make any difference. You can't sue them. They have enough money. They'll just shut that down. But they're being sued by Keto Pets. But it's beyond me. And I get it. The comment that came back from the customer was like, we don't know what to believe. And I'm like, you have to start training yourself to look a little deeper, not just, well, my vet said that, these cats died from H1N1. Therefore, I need to cook all my raw food. I said, you do what makes you feel best. Do what makes you feel best. Right. But I don't agree with that. I have not seen evidence of it scientifically or experientially.
Yeah. And I can guarantee you that the veterinarians, the conventional vets, they're not looking into this. They're just listening to the propaganda and passing that along. So, because if you dig into these cases, it it doesn't make any sense. So you have, like cat ate this food, cat died, supposedly was tested, or no, I think they said they found it. They didn't test the cat, they tested the food, right? They tested the food for the bird flu.
And wasn't it pasteurized milk that
Yeah,
they were drinking?
I think so too.
Either
Yeah.
pasteurized or unpasteurized. I can't remember, but that's like, okay, well, the milk had the bird flu, therefore the cow that got slaughtered and the meat that went in also had. It's like, what are we saying here? What are we
Yeah.
saying? How do we make this leap, right? And this bird flu thing, Dr. Jasek, has not been able to fly, so to speak, like COVID did. They cannot make it fly. They are trying, but we still get lots and lots of calls. I'm sure you do too. I'm sure your customers are like, what do I do? I'm sure, Farmer's Dog is loving it because they have all cooked food, right? It's all cooked.
Yeah, they're cooked. So it's cooked, so it's safe for, safe from bird flu. And like even that, who who knows? Like, did anybody, you telling me somebody actually did? Now, I don't even believe this virus exists in the first place, but just say it did, and you, okay, have some raw food with bird flu in it, and you take that raw food and you cook it and see if it eliminates the bird flu. I mean, that's what they're saying, that if you take your food, it could be contaminated with the virus, but you cook it and it's going to eliminate the virus. Have they done that? Have they done?
Right.
No, they haven't done that. They're just promoting Farmer's Dog. I don't know who owns Farmer Dog, but I bet it's some big corporation
Oh
at
yeah.
this point because they do so much advertising.
Yeah.
They do really, really high-end advertising. So they've got some big corporate backing. So yeah, well, they'll promote that, for people that don't want to feed kibble, they can feed this other thing. But nobody's proved any of this. And just even if the cat ate a certain food, drank milk, even if it did legitimately test for something, it still doesn't prove that that's why the cat died. They don't talk about, did they do any other testing? Did they test for other toxins? Did they check, organ function? Maybe the cat drank antifreeze and died of kidney failure. You have no idea. They're just there's no causation whatsoever. It's just, association. Like, when people during, all of the COVID stuff, somebody gets in a car accident and goes into the hospital and then supposedly tests positive for COVID and dies. Well, it was COVID that killed him, not the car accident, because they made more money with that. The hospitals actually made money for each COVID diagnosis. So the information is just so deceptive. And it kind of baffles me that people don't take a step back more and critically look at this and just think critically. This is just logic. This isn't, this isn't really rocket science. It's really just logic. And they're getting people afraid enough that one of these days they're going to come out with, the vaccine's coming for pets, and people are going to be lining up for it. They're going to be asking, should I get that vaccine?
It really depends on how you feel about what you've studied. Okay. What you've studied. And I think that history is so important, because you have to look at, how did vaccines actually even come on the scene? Why did they come on the scene? What happened when they came on the scene? How did they become so big? How did they enter into the mandate position, right? If you don't really know that, right, you're just kind of going along in life, like, well, I've always gotten vaccines and I've, always been healthy, and, it's no big deal. I can see where you would just kind of go along until something does happen. And then maybe you open your eyes, because quite frankly, nobody learns anything when everything's good, right? You're just rocking along. It takes
a wake up call.
Yeah, it takes a wake up call. And then you start looking around and you're like, wait a minute. And this is where it's difficult for me sometimes to talk to people, because it's like, how do you talk to someone who has never investigated dog food, has never looked at the pharmaceutical mandates, how many drugs like Librela? I mean, why would they hear about it? They're not going to hear about it. It's not even in their realm of thinking. But to explain to them why it's so important that they feed a species appropriate diet, it's hard to bring them up to speed, Dr. Jasek. It's really hard to say, over my 25 years of doing this, how do you really talk to somebody and bring them up to speed in a 2-minute conversation? Because that's about as much time as I have. I wear my shirt a lot, and I'm out in Arizona right now, and I get people asking me about it all the time. I was walking the other day, and this man said, I want to ask you about your raw diet. We are such dog lovers. They had 2 100-pound dogs. He said, we just love our dogs. I said, great. What do you feed now? Purina. Okay. And invariably you are going to have issues. Those people are going to have issues that they have no idea comes from the diet. Right? No idea. They're like, I just thought my dog was sick. And gosh, that word sick drives me crazy. Even my niece, who's a raw feeder, she texted her parents who were out here, and she said, Ness is sick. And my sister-in-law said, would you just call her? I said, tell me about how she's sick. Well, she just vomited up this yellow bile. I said, one time? Yeah. I said, is it almost her feeding time? Yeah. And this dog is really, just like go, go, go all the time. And I said, okay, does she have a temperature? Is she drinking water? Is she active? She's fine. Okay. How's she sick? Does she have a temperature? No. She's not sick. It was just that acid that comes into the stomach is ready to digest something. The ding, 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 the Pavlov's law. It's time for me to eat. Here it comes in. There's nothing to take out,
Right. That's why
Maybe
it's good to vary the feeding time so your dog doesn't, their bodies get on that clock, like, oh, this is when I get fed. So they
yeah.
keep kicking in that acid. Yeah, but that's not sick. That's just the body reacting to something. There's nothing wrong. That's just the body doing what the body is supposed to be doing.
Even categorize myself as sick if I threw up. One time, if I throw up and I feel fine and I have a fever, to me, I'm going to think, I ate something, is in my system that needs to come out. It's out.
So it's a good thing. It's a good thing. When Rex vomits up a piece of bone or something, I'm like, oh, isn't that great? He got that out of his body. His body didn't want that in there tickling his stomach lining. So he just gets rid of it. What a wonderful thing, you know?
There's a very different energy, okay, when you think like you think versus when my niece who said, I'm a helicopter parent. I said, you know what? Helicopter parents make their pets sick. Why? Because you have this energy of worry and fear and oh my gosh. And then you see things that aren't there. You expand little bitty minute things that don't need to be. You make a mountain out of a molehill and then you're afraid and you don't know what to do. So you take them to, you know, the veterinary clinic and then they give them things for just in case. And now we've compromised the body.
Now they have problems because they're on all these pharmaceuticals.
Right. So I really do caution our folks to not use those words. Words are powerful. Words create images. Those images create a feeling, and your feeling causes you to move in a certain direction.
Right. And if you Google a sign like vomiting, my dog vomited. What are the causes of vomiting? You're going to see a list of some things that could be really scary. And I think, internet searches are not organic. They program. So if you're always looking up certain topics, they're sending you certain information intentionally. And I think things are nefarious enough these days that they want people to be afraid. Why? Because they want you going into the vet. Why? Because there's big corporations that are influencing the media and what shows up on your Google feed that also own the vet clinics. So they're pushing this fear out there. They want people running into the ERs for these. Then the prices, oh my gosh. I was shocked. Karen, our nutritionist, she lives like on the east side of Nashville, about the same distance east that we are west. And she said for her to get into an ER, somebody from her area to go into the ER, she says $800 to $1,000 just to walk in the door.
Wow.
Just to walk in the door. So there's big, big money in this stuff. And people being afraid and doing that knee jerk of running in, to the ER, you're really just kind of supporting the machine. And yeah, like realize what dogs do. Dogs throw up sometimes. They have loose poop sometimes. There's stuff that dogs do normally. It's just part of their normal body processes, being a scavenger. But our whole system's designed to keep people in fear, and fear is so toxic. It's toxic for us, and it is toxic for the pets.
And you know what? I think that where we go wrong in our thinking is this. When people hear us say what you just said, in their minds, they think, well, how could somebody just be okay with lying to us, be okay with selling us something that's not good for our dogs? I get that a lot. Well, why would my vet say it if it wasn't okay? Because they're not sold like that. Think about how you were sold. We were sold on taking, not us, but many people on taking the COVID vaccine, right? How were you sold on that? You were sold as you are being a good and responsible citizen. You are not going to kill grandma or any of your neighbors. Be thinking about other people than yourself.
Yeah, don't be only selfish people refuse to take the vaccine because then they're out making everybody else sick. Yeah.
That is the way that things are sold. And when you really wake up to that, you see it in a lot of things, right? So I don't at least at this level that most people operate, they are not being facetious. They really are being told that they're helping their patients, and that the just in case antibiotics all the daggum time is just so that the pet doesn't get sick, right? They're doing these things because they've been sold on, this is how you are a great vet. This is how you're a great doctor. This is how you're a great human being, right? That's the way you have to go at it. You can't come at it straight on. Think about how do they sell wars, Dr. Jasek? They sell wars in the other way, right? This country did this to us, therefore we must retaliate, right? And that would make sense but it doesn't make sense if you know that the country that wants to retaliate is the one that caused them to do whatever they did in the first place. Does that make sense? Because
Right.
there's an ulterior motive. There's money in wars.
Yeah.
So again, you can't think, well, my vet wouldn't sell me something that is bad for my pet. Librella is bad for your pet, as are over vaccinating. And I thought it was interesting that, you sent me another thing where a customer is practically begging you to go out and do something about PACFA because they're coming down on, you can't go to a groomer. You're not going to be able to go to a dog trainer. You're not going to be able to do anything unless you've had every single vaccine out there, right? And this is going to greatly hurt our dog groomers, greatly hurt our trainers, and quite frankly, our dogs. What was your thought about that when you read
Yeah.
that?
I think, I mean, there's a continued, squeeze on the vaccine issue. We've seen changes in rabies laws. I mean, in Colorado, they passed that law where, no dogs have to have a rabies vaccine to come into the state. So that means that only dogs after older than a certain age can come in. So then young puppies, because there's a lot of rescue and foster agencies in Colorado, so young puppies cannot come across the border because they're not old enough to have the rabies. So just their care will suffer. The increased mandates at vet clinics, they're just getting more and more, stringent on, nope, they won't see pets without vaccines. I hear it all the time, all over the country. And now PACFA, it's just like this overarching agenda to push the vaccines on the pets. And like, why is that? I mean, they're just making pets sicker and sicker and sicker. I've said this before. I see cancer patients now all the time, 1 to 3 years. The dogs that young should not be getting, they never used to get cancer. And I think a dog could probably eat the worst diet in the world. They're not going to be diagnosed with lymphoma at 1.5 years. That has to be the vaccine. So when I hear this, like about PACFA, like who's pitching that to them? Somebody is saying to some higher up in PACFA, you need to do this. And I think it's the pharmaceutical industry is behind it, somehow going to them, incentivizing it, making a big donation. This is the way stuff's done, guys. They give them a nice big donation and say, hey, and they might present it from medical, like, we feel like, in order to keep disease from spreading, you should be promoting this or whatever. But, and oh, by the way, we'll, give you a nice healthy donation if you change this. So I think that's what's going on, because there's not even any direct evidence that these vaccines help dogs stay healthier. The evidence is actually to the
The
contrary.
opposite. Yeah.
But I think pet parents, it's time for a revolution. Like, you don't want to do this. You can't just roll over. I mean, I hear so many people say, well, I just had to get that vaccine because, we go on vacation and I got to board my dog. Well, let's start finding other alternatives, or maybe, you get neighborhood groups together that help take care of each other's dogs, help house sit for each other. The veterinary industry isn't going to change, and it's going to keep getting worse. So you're going to have to find your own alternatives. If you have a dog that needs to be groomed, learn how to groom it yourself. I mean, would you really compromise your dog's health just so that you don't have to, bathe and trim your hair? I know some of these long-coated dogs, it takes some, learning to do that, but you could learn to do it yourself. And that's what people need to do if you really want to avoid the vaccines. It's like this comes back to the really holistic or part holistic. If you're caring for your pet holistically, you say no to vaccines, period. And you do things that keep your pet from needing to be vaccinated. And I have clients that they got to put their pet on an airplane because they travel with their pet. I'm like, then they're like, how do I get out of the rabies shot? I'm like, well, you can't. Don't put your pet on an airplane. I mean, that's your choice. You go someplace where you can drive. And if you can't find a place to board, you go places where you take your dog with you. That's what I do. Rex comes with us, when we go places. There's just no way I wouldn't put a dog in a boarding count anyway. But I think that's highly stressful for most dogs. But I mean, you need to make these decisions. And I see people all the time compromising their pet's health for convenience. And, I don't know. I have a hard time understanding that, but that's what a lot of people do.
We picked the minorities, the minority group, right, Dr. J? I mean, people we are really in the minority, those pet parents who actually look at the diet, understand the diet, will find alternative ways to treat their pet for flea and tick, right, or heartworm. They're not going to do that. That's the minority. It's not the majority.
By far the majority.
Right? It is. I mean, I look at the people that I just talk to on a daily basis that still have no idea about the raw diet. Now, they probably do know about Farmer's Dog and Fresh Pat, they know about that stuff, but they're like, do you cook it? No, it's raw. And the reason, if you listen to what Farmer's Dog does, they try to make it sound like it's, they use all the words that the raw feeding people have always used and always seen, right?
Yeah, they do.
That's what they do.
Very, 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 very good marketing.
Oh man, best commercials, right? And I'm like, we've been saying that for years. We just don't do the big commercials. But again, when you really look at the majority of people, they don't have the time or the inclination or the bison balls, I will just say, to go against the norm. And I mean, there are just some people that are rule breakers, right? And for instance, when you're in the hospital and they say, you're not allowed to go outside, right? You can't leave this floor. You have to stay in this unit. And you know that you are very capable of going outside, that you need to go outside. You want the fresh air. You need the sunshine. And you say, if I go outside, will you deny me services? And they say, no. And you say, I'll see in a little bit. I'm going outside. Because they can't stop you, right? They can't stop you. They're not going to deny you services. And if you're worried about a face that is disapproving, then you will stay put. But it's always, well, what are the risks and what are the rewards? Right. And if the rewards are going to outweigh the risk, we're going to go for it.
Right.
Rule breakers are going to go for it.
It's your body. Yeah. Rules are subject to being disobeyed. There's a thing called like civil disobedience, right? Like if the rules don't make sense, maybe we have to not just blindly follow the rules, but say, hey, your rules don't make sense. And this is what works for me right now. So I'm going to go outside and enjoy some sunshine.
Well, Dr. Jasek, think about what we have seen in recalls in the raw dog food industry. Okay. One, you don't they're not a recall because a dog has gotten sick or a dog has died. That doesn't happen. It's a recall because they have there can be no bacteria. Now, we're not going to delineate. We're not going to look at, is it good bacteria or bad? There's no bacteria. What does that mean? That's ridiculous. Okay.
Right. Nothing in life has no bacteria. Your kitchen counter has bacteria. Hate to tell you, no matter what you put on it to disinfect it, you're going to have bacteria on there.
Right. But you can have 1,000 dogs sick, all feeding Hills brand food, and the FDA is slow to notice, slow to do anything.
Don't look here, look over here, right?
Right. But my point is this, even back to those two cats that we're talking about, is that rules, in my opinion, change because not the majority, a very slim minority has done something that they feel like they've got to guard the whole world. And it's like, shouldn't this be on a case by case basis, folks? I mean, right? I mean, I don't know if I made that clear. My point is this, is that many rules are laid down due to very little evidence that there's a problem.
Right.
I mean, you look at rabies, you look at all of the COVID stuff. I mean, just look at the COVID stuff. And now, I kind of wonder, I don't know if you have heard anybody talk about it, but do you feel like the people who actually got the COVID shot are worried about it now that we're hearing all this, now that we know that, there's problems?
I
Are they worried?
don't hear people talk about COVID anymore. I don't hear people talk about long COVID. I mean, I don't watch like the general news, so I think it depends on what are they hearing now? They're hearing bird flu. So I kind of think people that were worried about COVID, they now got something else to worry about. So they're more focused on that. But I don't hear people talk about COVID. I don't hear people talk about I used to hear people talk a lot about long COVID. Like, well, I got long COVID now, because they have some chronic symptom of whatever. And it's long COVID. But now it's fear around the bird flu. I think the fear agenda, got to keep it fresh, got to keep inventing other things for people to be afraid of. But this is scary to me because they are already bringing in the pets and the food supply. And that wasn't the case in COVID. So, you just had to distance and, they closed down businesses and stuff. That was bad enough. But this is potentially going to be impacting our pets. I mean, what if they just say all pets now, you gotta have a bird flu shot or a bird flu test, and they test positive, they euthanize them. I mean, what's stopping them from doing that? That's not that much more ridiculous than some of the other stuff that's already going on.
Well, it's like, all right, let's test your dog for Ehrlichia, right? Let's test your dog for Clostridium. Let's test your dog for stuff that they're naturally going to have in their body if they've been exposed to it. Does not mean that they're symptomatic. Does not mean that they're going to cause another dog to have a problem.
Right.
Right. It is, it's maddening. It really is maddening to me. And I said this to my mom the other day, even about contagion, and Dr. Cowan and Kaufman talk a lot about contagion and that it doesn't really exist. And I said, think about this. The reasoning, it's so easy for people to reason why things are the way they are. So you have a family that supposedly gets the flu, and you got 3 that do and 2 that don't. The reasoning is my immune system was stronger. And that's just acceptable. Well, my immune system was stronger. And to me, that doesn't make any sense. It's like, if there's contagion, there's that little boogeyman, then it's out there. It should be gobbling up everyone like a Pac-Man,
Right. Right. And that's the immediate train of thought typically is that, oh, I've got symptoms, I can probably spread this to somebody else. The whole myth of contagion is is very strong. But yeah, I mean, Dr. Cowan doesn't even really think an immune system per se exists. So he's got very, very different ways of looking at health and the body. But when you really dig into some of this and see where he's coming from, makes a heck of a lot of sense. I mean, we've just been taught to believe a certain way that you get symptoms and then somebody else gets symptoms. Well, you're spreading some boogeyman to that person. What if you just were exposed to the same toxin? Your body is, reacting to something in the environment because you were in the same place. It's like, I've heard it said, if two people are climbing a mountain, well, you're going to have rapid breathing, rapid heart rate. You're going to be sweating. Did one person get something and spread it to the other person? Like, no, you're exposed to the same stuff. You're doing the same thing. So that's your body. It's a common reaction to something in the environment, not something that's spreading back and forth. But that's how they keep people afraid, right? Is that whole contagion myth.
Think about, is cancer contagious? Cancer is not contagious. And yet, it's shocking how many people have cancer. How many people have cancer? Now, Dr. Kate Deming, has just, she finally got out of the traditional cancer treatment way because she was like, she said that the boats of people, she kind of uses it now. She's like, they just keep coming and they keep coming and they keep coming. And we're something is wrong. We can't keep saving all these people. We have to figure out what's making them sick. Right. What is it? What is it? And so many different cancers. And you've talked about this, that you're seeing younger and younger animals with cancer, different types of cancers that we've never seen before. So the question is it food, water, air, EMFs, dyes, preservatives, chemicals, all of it? Is it all of it? Yeah. Right? And do they just keep producing more and more of that thing that the human body and the animal body was never meant to be exposed to at those type of quantities? Right. And that's big. That's a big machine, right? That's a big machine. I don't believe that it's just luck of the draw,
or genetic. Yeah, just bad genetics.
No, it's too much of it. Too much of it. But anyway, we hope, guys, that no matter what clinic you are taking your pets to, that if it doesn't seem right to you, learn to buck the system, right? Ask, well, what are you going to do if I don't do this? Right? And at least you'll know, and then you can make a decision. Right? Are you not going to see my pet if I decide not to do this? Because I can tell you, I have a lot of customers that will say, my vet knows that I will not come back if they decide to go this direction and that direction that I don't agree with. So first you got to know, what are the risks? What are the rewards? What is the consequence? And then what are your options? And trust me, there's a lot of options out there. If you're so inclined to think about the options. No, I don't put my dog on a plane. No, I don't put him in a boarding facility. No, I don't take him to the groomers. Right? I mean, think about that, Dr. Jasek. Just eliminating that, you've eliminated a lot of potential dangers for your dogs if you don't put them in those situations.
Yeah. And most of the time, what I recommend to people is you don't go into your vet for wellness stuff unless you have a really good relationship and they're not pushing the vaccines and they're truly holistic and they're okay with you feeding raw and all that. If don't go in for routine wellness if they're just going to sell you a bunch of vaccines and other preventatives that are going to make your pet sicker. If they get sick or injured, you go into the ER. And most people, it's pretty rare that I hear about somebody not being able to get into an emergency clinic for, if their pet's sick. Because you can say, I take my pet elsewhere to be vaccinated. Let's just, help them out here. Yeah, they're current. They got all their stuff. I left those records at home. You just kind of brush it off. They don't tend to push the vaccine issue. If you've got to go in, I'll say too, just comment on what you were saying earlier, the clients that have the best results talking to their vet about not vaccinating are the ones that, come on, not mean, but they are firm. Like, look, I'm not doing this. Do you want me to stay here? Do you want me to go to another clinic? Because I'm not doing this to my pet. I believe they're poison. And I have clients all the time. So like you said, they have that discussion. And if they're you have to avoid the corporate clinics, because the vets that work in the corporate clinics, they have to follow the corporate bylaws. It would be very hard for them to say, no, I'm not going to follow the corporate rules, because if that got found out, they'll lose their job. But if you're going to a private clinic that's privately owned, you can talk to the owner, say, look, I'd like to keep coming here. Really like you guys have been coming here for 20 years, but I'm not going to keep vaccinating my pet because I don't think it's healthy for him. And you're just that blunt with them, but you got to be ready to walk out the door if they say, no, I'm going to insist on it. But I think if you're firm, I think you're going to go a lot further, because they know you're not going to take any nonsense from them. And I was thinking back to this Librela thing. If your vet is asking you if you want to try brand new treatment that you've never heard of, number one, don't put anything in your pet that lasts a month, because if they react, you can't take it out. And that goes for these heartworm. There's like year-long heartworm injections out there now.
Oh my.
ProHeart. Don't do that. Don't do the 3-month flea and tick. I mean, that's an absolute no right there. But if it's something new, say, well, I'd like to learn more. Could you go grab the package insert and let's read that. Let's read over it. And because I want to know what the potential risks are. And I bet you'd be shocked. I bet your vet would be shocked, because they probably never read it either. But that's a really good way, even with vaccines. Hey, could you show me the package insert, the vaccine that you're going to put in my pet? Because I want to be sure I'm fully informed. I want informed consent. And just want to read the package insert. It's a very innocent question. If they refuse, that would be a red flag. I'd be getting the heck out of that clinic. And you can also look them up online, but you're not going to know what brand your vet's using. Just ask them to go back to the fridge. Could you go get the package insert out of that rabies vaccine that you want to put in my pet, because I want to make sure it's safe, and let's read over that together, and then you can ask them about all the different side effects. I mean, to me, that's a pretty simple thing to do. Your pet won't be happy about it, but it's a very legitimate question, I think.
Well, think about, I always want to say, what did your clinic do or your vet do during the whole DCM debacle?
Yeah.
Right? Did you guys just jump on board, without really doing? To me, it never made sense. I mean, why would those foods who had nothing to do with taurine, right? Why would a raw diet that has taurine in it cause DCM in your dogs? Now, they didn't specifically go just after raw diets, but it was basically any brand that wasn't a Hills brand, right? That's what they were doing. They were trying to move the test and the so-called, research to slant their way. And the reason that Keto Pets filed the lawsuit was because they suffered, along with many of us, sales decreases, right? You lost customers because you have a dog that is on a raw diet, perfectly healthy. They come in, put him through some sort of, I don't know if they did an echocardiogram. I'm not sure exactly what all they did with their dog cardiologist. And oh my goodness, your dog has DCM. Therefore, we're going to put you on this crappy diet. It's going to help your pet's heart. And you're like, how is that? How is that working? And think about it, Dr. Jasek. Did we not see the incident of DCM just substantially go off the charts?
Oh yeah, because they said that dogs need grain to have a healthy heart, that the grains are important because, you see wolves out there eating in the cornfields all the time, and the wheat, they're out there just nipping those little wheat heads off and stuff like that, right? No, they're killing the cows or the elk or whatever else is eating that stuff. So the whole premise didn't make any sense at all. And then they lumped all foods that have no grains in them together, grains being corn and wheat and barley and things like that, rice. So kibble diets that had no grain were lumped in the same category as raw. So even that didn't make any sense, that those diets are so different, like night and day, but you're putting them in the same category because they don't have grain. Well, what are diets like Hill's? They're all grain-based. Read your prescription diet labels. They're just all a bunch of grains. They're very plant-based. So, and that because it's cheap to produce those foods. So yeah, they wanted those foods to be sold more. And it wasn't even the dogs, I think, that got diagnosed with it. It was just preventing it. The vets were telling people, oh, you gotta add grains into your pet's diet. So somebody goes in and they're just feeding a purely animal product diet. And we're told, oh, you got to add grains in, to have a healthy diet with no base. It's another one of those things, no basis whatsoever. And it turns out that the data was fudged that went to the FDA that linking the DCM cases to the diet, that they look at case studies and they wanted to push this agenda that dogs need grain. So if any of those case studies didn't fit with what they wanted to prove, then they just throw that data out. And so they fudge. Most research studies these days are fudged. So yeah, it was all a false claim. And it was so obvious. Like to people, it's so obvious right from the get-go what they were doing. But like now you try to undo it, even though it's been completely disproven. That's not being blasted out there in the propaganda, but they just let that narrative still continues. I still have people saying, oh yeah, my vet or my cardiologist said my dog needs to eat grain.
See, and for me, Dr. Jasek, this is where I would say I would not want to be putting my dog in anyone's hands in a clinic that ran with the DCM, that ran with the COVID, and now that may be running with the bird flu, because it shows that they really do not do the research, that they are listening to a narrative without checking it out. And so what does that make you feel comfortable as a pet parent to say, gosh, because for whatever product, the research has been fudged. The research has been skewed for sales, for profits. And this clinic that I'm going to, they just jump on board with whatever the new narrative is that may or may not be in my pet's best interest. Now, I don't really know. Does that mean, well, I think it does mean this. If you're in a corporate clinic, you do not get to think independently. It is group think, period. So maybe you need to find out if you have some independent thinkers. If you have any people, any vets in a clinic that actually push back, that actually question. And if they do question, have they been threatened to lose their job? I don't know if you can ask these questions, but I would. I mean,
you can ask them. They don't have to answer them, but
right.
The corporate clinics are definitely going to be much worse. Your BCAs and your Banfields and Blue Pearls and a lot of clinics appear to be private, but they've been bought out by corporate. I have a lot of clients tell me this, like, oh, I was going to this one vet for 20 years and just loved him. And then they got bought by some big corporation and everything changed. It's like going into a completely different place because the rules are different. So, that would be a really great starting point, is just make sure that the clinic you want to go to is not corporately owned, because that changes everything. It's good. You're going to be just beating your head against the wall trying to get an alternative way of thinking if you're going into a corporate clinic.
Yeah. And you can always sign up to work with Dr. Judy Jasek and her team. I mean, you can get a second, third opinion. You could get some um, uh, questions answered. How would you handle this? Why does this seem weird? I mean, what have you seen? Because you can train your mind to not see things. Certainly, that's you see in medicine all the time. Don't ask questions. Just follow the yellow brick road,
Follow the
right?
protocol, standard of care, follow the standard of care.
Right, because if they were independently thinking at this point in time, all Librela would be pulled. Nobody would be giving that to their pets. You have the FDA stepping in, which they usually don't go up against somebody like Zoetis. So think about that. You got the FDA going up against, or at least putting out the information, and Zoetis is saying, we're still going forward and marching as hard as we ever did. Any vet clinic, I think, that is offering Librela, and maybe it's a question that you ask your vets. I mean, are you selling prescription diets? Are you pushing Librela? How do you feel about the dilated cardiomyopathy? There's 3 questions right there that should help you, kind of peek under the skirt, so to speak, and see what the heck is
no
going on.
veterinarian with any amount of ethics would be giving Librela, knowing that the FDA, even if there's any amount of suspicion raised on a product, you should stop giving it. I mean, why would you risk your patients if, there's, even an inkling of a question about a product safety, they should be stopping it. But just because Librela comes out and makes some statement, or Zoetis comes out and makes some statement about Librela that, they're just downplaying it and that it's not as bad as, that people are saying and all that, then it's okay for the vets to keep because the pharmaceutical company said so. Oh, they're only saying that to keep their profit going up. And sadly, that's what a lot of the vets are probably doing too, is just keeping their profits up, especially if it's a corporate clinic.
Yeah. Well, we hope that we've given you something to think about today. I think that we always have to train our minds to be courageous, right? You think that you're just going to be courageous naturally. Courage is not born out of backing away from fear. That's not courageous. I mean, how do you build? The only way you build your courage is that you walk through that fear and you get on the other side and you say, wow, I did that. I can do that. I'm still walking. I'm alive. It didn't kill me. Right. And then you do it again and you do it again and you do it again. Yes, there are some people in the world that are just more aggressive in their life and march forward. But for the majority of people, we back down. We never build our courage because we are afraid of the fear. Now, does that make any sense? How are you ever going to become courageous until you have walked through your fear, made it to the other side? That's the only way you can do it.
Right. And it's like a muscle. You gotta flex it. You gotta work it. You gotta go outside your comfort zone and, practice asking these hard questions and challenging authority a little bit and challenging the rules. And, it's if once you start doing it, it does get easier. It's like exercising a muscle. You got to keep, pushing yourself more and more and more out of your comfort zone. And then, you start to not care so much what other people think. If we cared what people thought, DeDe, we'd be doing something different.
Yeah. Well,
we'd be laying on the beach. We'd be laying on the beach somewhere, tired or something.
That's right. That's right. All right, everybody. You can find Dr. Judy Jasek and her team at ahavet.com, ahavet.com. And you can also get your dog on a species appropriate diet. We ship all over 48 states and Alaska too. It's very expensive, I will say, if you ship to Alaska, but yeah, it is. But we do ship all over the country, and we
ship
are
to Tennessee.
Yeah, we sure do. And Arizona too. I get my own food shipped out here right now. But yeah, give us a call. Go into the chat, sign up for a free 20-minute consultation. I tell people that I meet all the time. I say, even if you don't buy from me, at least go and talk to somebody that can help you help your pets, right? And we do that. We consult with a lot of people who don't buy from us, but there's not a whole lot of companies that will take the time that we will take with customers and potential raw feeding pet parents, because we care about the pets just like you.
Yeah.
We want the pets to be healthy. So get over to Raw Dog Food and Company, where your pet's health is our business. Oh, and listen, tell everybody about the Raw Dog Food Truth. We were on the Blog Talk website. Now, listen, we're on Spotify, we're on Apple, we're on a lot of different platforms. We moved it over. The Blog Talk, after all these years, they closed it down. I don't think they kept up with the time. We moved over to Buzzsprout. We do have a web page there, but you can hear the Raw Dog Food Truth anywhere you get your podcast. And if you can't find it, go into our chat. We'll help you find it. Maybe you want to tell your friends about the Raw Dog Food Truth podcast. We give away a lot of free information here. And it's an easy way to help somebody that doesn't really want to listen to you say, hey, your dog looks terrible.
Yeah,
Your dog's
just send
fat.
them over to us. We'll tell them.
Okay. All right, everybody, get over to Raw Dog Food and Company, where your pet's health is our business. And what, Dr. Jasek?
For friends, don't let friends feed kibble, y'all.
That's right. We'll see you soon, everybody. Bye-bye.
Bye.